I'm LaFromboise, the Director of Library Services.
And I'm George Strawley. I'm with an organization called the Network of the National Library of Medicine.
And George and I have been talking for at least a year now about ways to improve health literacy information needs in the community. And one of the big first steps is how do we even know what the health information needs are? And so this is, a good first step. I think I have an okay idea. And another thing I'd really like to potentially do is just work more with community organizations that are already doing kind of this health information work, and then making sure that the library can kind of be a hub for information as well. So if there's information that you guys are putting out that you would like to have a wider audience, how do we combine that with the efforts that we're doing in the library? And then another great thing about understanding the needs and having an idea about where we're going to go next is that with the help of George, I can potentially write some grants to meet the needs if they're not already being met. So I'm not going to stay on this slide. These are our community health nurses. So, and I'm not putting it in presentation mode because I just want to take notes while we're talking. So up at the hospital, what do you see that some of the biggest health challenge, not information, but just health challenges in general?
I know a big one is people have a hard time making appointments or scheduling appointments. So access to care. Also, I guess educational, on chronic illnesses. So there's not a whole lot of short staffing. So there's not a lot of time to be able to actually sit down and have 30 to 60 minutes set aside just to educate a patient on a chronic illness. I think those are probably two of the bigger challenges there.
And so with that lack of education for that patient, they're not following up with how important their doctor is, follow-up care really is.
Yeah, follow-up is a big one. Once they do actually get in to see a provider, the provider will be like, we'll see you back in, 6 weeks or whatever. And a lot of times there's trouble there, with that follow-up. Either the provider's gone, or they don't really have the schedule out just yet. So patients get, frustrated when they're not able to set that up so that they can plan for it.
Are there any specific, I know you have chronic illnesses, but any specific illnesses that you think would be meaningful to have more brochures or just have information, have us aware of, so if people come in asking questions, we can show them resources that they can potentially use to learn more about it?
Well, I think the biggest ones that everybody touches base on is diabetes and nutrition, obesity, hypertension, and I feel like a lot of people need that education with diabetes and hypertension to prevent chronic kidney disease, that type of stuff. But our big job with public health, and it's kind of a national goal that they want, is people to be aware of the rise in cases of sexually transmitted infections, and just access to care there. So there's a lot of outside resources other than the hospital that we don't even know about. And so it's kind of a challenge for us to refer them to an outside entity without us knowing having a full list of what resources are out there. So I think that's a big part of it too, is knowing what resources there are.
Yes, I know a lot of, there's a lot of discussion about visits to emergency rooms and problems with follow-up care. That's very common to health literacy. So
Yes,
you're not doing-
our emergency department is hit with all kinds of visits, down to where people want to be seen for their MRI to be reviewed, or medication to be refilled, and so instead of going through the hassle of trying to get scheduled, they'll just utilize the emergency department rather than like an urgent care visit or a scheduled, so it's kind of tying up those emergency department visits with, something that could be seen in the clinic, like non-urgent visits, I guess.
Okay. Okay.
All right, well, I'm going to go to the next. So I know this is more geared towards the public, but what type of health information do you think is actually needed? Is it that one-on-one? Would having access to a list of sites or, having someone walk them through, would that be helpful or useful?
I think so. As, even not in the role as a nurse, but a role as like a patient there, knowing what resources or services are provided at each resource. I recently found out, so at our hospital, we're able to provide insulin pumps and continuous glucose monitors to our type 1 diabetics, and that was something that I hadn't even known about. And so there's, we have a large majority of type 1 diabetics who are on insulin pumps, and so by being able to provide those at our facility, it cuts down on them having to order outside supplies, waiting for shipment, waiting on insurance approval, and so I don't know how many actual patients know that information. So as a patient, it would be nice to be like, oh, I can go in and schedule an appointment with a nutritionist. I don't need a referral for that, or I can go, visit with a diabetic educator and possibly get set up with this. So I think that would be a really good thing to know what resources and what they provide, what services they provide.
Lauren.
Like you said, one-on-one. I like that concept because we have such a huge elder population here. Not all of them have access to the internet, and some of them even have reading issues. So to be able to have someone explain to them what is actually going on, what could happen, the importance of each specific illness.
And I'm thinking in the library, what we could probably do is have maybe, health information out, like office hours. That's a really poor way no one would show up, but, having time where we could actually sit down with somebody, we could go in the conference room, shut the door if they don't want to, and just bring them to those resources and read them if they need them. We wouldn't be able to give them any actual health advice, but I think that's a great idea because I think, especially in the library, so much of what we do is really passive, that we forget that people have needs and they're often really uncomfortable asking for help. So, do you think, no, I think that's on the next slide. All right. So, you personally in your either professional or your personal lives, how do you actually get health information?
So we follow a lot of the CDC guidelines, and so that helps us to be able to treat our patients appropriately with the correct information and medication. We also go off of, say for instance for immunizations, we do immunization.org. So there's different kind of health websites that we're able to access as medical providers. information, I guess people kind of, you know, do Google. And so, I think it's really helpful to let people know, like, look for kind of that scholarly article, you know, type of, like, information. So you want to make sure that it's, you know, up to date. You want to make sure that it's, like, good data. And so if people were to be kind of more educated on those, like, scholarly type websites or articles, I think that would help them a little bit, you know.
Do you need information that's maybe reliable but also easy to read, is that an issue for you?
So like so we had a few patients who had a diagnosis of like PCOS. And so it's, you know, you only get so much information from the provider or from the nurse to where you're going to go home and like Google it and read up a little bit more. And so I think by, you know, that's fine doing your own research, but making sure that it's like legit, you know, a legit resource.
Mm-hmm. Mm-hmm. Okay.
I definitely think Google's probably, I mean, you open your phone, that's the first thing that you're using. I'm also wondering, would it be useful or meaningful if the library had as many sources in one place as possible? That way, you know, if people are coming to the library website or we can direct them there, then they can just have an idea of like, oh, okay, this is all the information, or not all of it, but some reputable places that we can get information.
Yeah, I think that it's very helpful to have as much resources and information in one spot. That way you're not, you know, well, I have to go over here to get, like, say, the medical research. I have to go. I think people appreciate it a lot more if they're able to do business in one area versus multiple different areas. So I think by the library having maybe like a certain section for that or something, people would appreciate that a lot. I would anyway.
Well, I think it'd be easier for us, especially for helping people, that we're not like, where was that again?
Right.
So this is the physical. How do you, or how do people that you've heard of, how do they access health information? And this is like by their phones, you know, word of mouth? Is it, you know, how physically do they get information?
Pamphlets, a lot of people take the pamphlets on the doors outside of the offices. And then like the community health fairs that we do, I think a lot of people get a lot of information from those.
We also, was it 2 years ago, we had like, so syphilis, you know, is on the rise nationally, locally, everywhere. And so when we were fully staffed and we had 2 extra helpers in our clinic, we kind of went ahead and just did flyers on like how to get testing. And our 2 helpers, I think we printed off probably over 100 flyers, and they went to every single establishment on like in the community and hung up the flyers, even like in each bathroom stall at the hospital. And we noticed that we had like a huge increase of people coming in to get testing. So community outreach, I think, really helps to just educate them on where to get that, you know, where to access like testing, treatment, you know, medication, all of that type of stuff. So a lot of it was kind of like the field work of public health nursing. And then after that, we started incorporating that information into like the health fairs and stuff. So it was a lot of footwork.
Well, I'm happy to hear you say pamphlets, that people are getting them, because I'm thinking if the library is going to try to put a lot of information in one place, it would be great if those pamphlets could be through the hospital, and maybe, you know, maybe after a visit, the provider could be like, you know, and if you need more information, the library can help you, and here's their pamphlet or something like that. Yeah, I think bathroom stalls are actually great because you're a captive audience. So, especially as health information, professionals and specialists, what kind of information would you want to see in the community? Would you want it to be, more interactive, and, or, what do you think would be most meaningful for us to be able to put out there?
I think that community health fairs are a big hit just because people can go there for the incentives along with like information. And so if you're able to gather, whatever information, like we usually try to touch base on immunizations, STDs, and is that mainly, those are kind of our main points. But it's nice to be able to get out there and kind of have our faces out there so people know what we do and what we offer. And then for us to be able to walk around also and see what else is offered, for the patients. But I think just a lot of that, like Lauren said, a lot of elders don't have access to like Facebook or the social media. I don't even know if they listen to the radio, like local radio or not. And so that, I don't know, it's kind of like a hard.
The local TV station, the newspaper, some people still buy that. What else I thought would be, so if we had patients interested in a specific illness, if there was, how they have like, say, AA meetings. So say you have like something similar with the medical though, and have a medical professional come down and talk with that group as a group and answer questions.
Is there a possibility for like 16 to 18-year-olds to be able to set up their own health appointments? Because I have experienced a lot of parents not believing that their children have illnesses. And the children do want that help, but because of the ignorance of their parents, they can't get that. So I wanted to know if that was possible. And if it is, I want them to know that they have that option to be able to get help. Like, I know someone who's really needed dental ever since she was little, but her parents didn't believe her, or she had asthma, but she didn't believe the doctor. Like that, but she wanted help, but because of her age and guardian, she couldn't get that help. So I was wondering if that is possible.
I believe the only, so they need a parent or guardian until they're of age, so, pretty much 18, 19, unless it's like a women's health thing. So there's Montana law stating that any childbearing age woman can start like birth control or be seen in like a women's health clinic without a parent or guardian. But I think if it's just general medical like that, they have to have a parent or guardian.
But are they able to call and set up that appointment to force their parent to go with them?
They can, and then they usually will call and remind them. But ultimately, it's the parent's decision to bring them or not.
Because I would like the youth to know that they can set up their own appointments and that they do just need to bring a guardian. Because there is a lot of youth in this community that do want that help, but because of parents not doing it, at least it's just a step so they know they can do it.
Right. One other thing too, like so, for instance, with like dental or behavioral health, and I think this would probably be a good thing for information is the schools offer a lot of those screenings now. So like, for instance, with my kids, I have them set up with the pediatric dentist, we see them every 3 to 6 months. So I opted out in the registration form for dental. Well, on one of my kids, I must not have opted out. And so is it Smiles Across, something like that? Or one of them went in and my daughter was like, Mom, I got my teeth, checked. And I was like, where? And she said, at the school. And so I think if, they were able to utilize those, and they also have, like counselors and stuff for, certain things. So if they, like if the student or the kid was able to kind of confide in, one of their counselors and like, I want to be heard, like I feel like there's something wrong. And that might even help with like a lot of our suicidal ideation, like being heard and kind of being acknowledged, like, yeah, I hear you, you need, help reaching out. If they were able to confide in like one of those counselors or a teacher that felt comfortable talking with the parent, that may be a start on helping to kind of bridge, the parent and the child on making those appointments. But I think for now they have to have that parent present with them, like the provider won't see them without it.
Because that would make sense. I just want to know if they are allowed to set their own appointments and if like, just so they know how to do that. Eventually, when they do become an adult, they won't know how to do that. They can't rely on their parents to do that.
Yeah.
So it'd be awesome if they could teach the kids how to set up appointments and like how to fill out those papers. And not mess up like I did. and just to like teach them how to go through those processes instead of them just being thrown out and not getting the help that they need and that they deserve.
Yeah, I think that they could definitely reach out, and then like I said, once they were scheduled and presented to the hospital, though, they'd have to have like a parent or guardian there. So, and I think it's just anybody over the age of 18. So say there was a 16-year-old, if they had an older sibling, they could bring them in. Bring them in.
See, that would be awesome. Like I would bring my little sister.
Yeah, you definitely could. If because even now we have a lot of people who are behind on like immunizations, and so we have like aunts or grandmas who will bring in their the kids to get updated on immunizations. And so that's another, like for education wise, getting it out there that children have to be updated on immunizations in order to participate in like school or Head Start or any daycare. So they are able to do that.
Oh, okay, yeah. If that was like a little pamphlet you could give out to the high school students, that would be awesome.
Yeah.
For them to know that it doesn't necessarily have to be their legal guardian, just someone from the age who can bring it. That would be awesome.
All right. Well, you guys are out of time, but I have one last question for you. Being here at the college, do you feel like there is specific information that would be useful for college-age students? And that's hard here because our college-age students are from 17 to elders.
As far as just like health information for them?
Yeah.
So I always just kind of take away from like my college experience, like I started out in Missoula, and so I always and I had a lot of friends who went to Bozeman, and so I talked with a lot of the graduating kids who come in for like their admission stuff, they need like a tuberculosis test or update on immunizations. But I always kind of like let them know, like reach out to Planned Parenthood if you have questions about birth control or testing, like the Curry Health Center. So I always kind of encourage them to just look into what's offered out there because they are, a college student. They may be paying that student health insurance to be able to receive like that kind of care. And so I feel like growing up on the res, where we don't really know a lot about like health insurance or even being able to be seen at a different facility. Like our hospital is unique because we offer everything at one place. We have the ER, we have pharmacy, we have x-ray lab, like we can go there and get kind of everything done versus if you're like in a different bigger city, you may have to go to a certain pharmacy. So I think just letting them know that there are, options out there, signing up for like Medicaid, and knowing what they're able to use that for. Because I didn't really know about that either. You know, I'm like, I don't know, where can I be seen? Like, I'm not feeling good, you know? And it's like, well, say, for instance, like we went to SKC for our nursing, and I didn't know that we were able to get care like at another tribal, you know, facility and so I think Lauren actually told me, she's like, Katie, you just have to go, you know, you're still like a enrolled member of a federally recognized tribe, like go there and sign up. And so just kind of educating the public about that.
I know at SKC, I had a toothache and I like just went up to the dental hygienist area and I was like, how do I get this looked at? And they were like, come sit in the back. And so I got all of my molars pulled at SKC, probably by students, no. I was like, all right, so I don't have to pay for it. All right, so just any last thoughts that you guys might have for health information literacy?
Nothing comes to mind. I mean, just having, you know, just that information, I think can be.
And do you think working maybe a little more, a little closer together because I think we have a pretty good community reach. Do you think that would be meaningful for your program?
I think so. I know like tribal health and all of their different services, like a lot of people kind of turn their back against, I guess. Mm-hmm. And I can see why, you know, there's those frustrations and stuff, but I, you know, feel like we still all work together. And so we work like with the nursing students, and, you know, we try to do our outreach clinics with them and stuff. So I feel like if we are all just able to continue a partnership, it would really benefit the entire community.
Or even like workshops, you know how you guys do those here at the college? Like, you know, put a sign-up sheet on specific topics and see if there's interest, and then we can find a health professional in the community who's, you know, come in and do that presentation and answer questions.
That'd be great.
Can I ask a question?
Yes.
To what degree do you find the material that you do share with patients to be culturally appropriate, or is it a case of making do with something that wasn't designed with your community in mind?
So we actually do like health education or sex education. We work with like the middle school, high school, the East Glacier School. And what we've kind of learned is really kind of culturally basing some of that education into it about, and I hope this answers the question.
Sure.
So it's kind of like, you know, whatever this book, what they're talking about in this book, we are able to adapt kind of like the cultural competence to it as far as like what, you know, our beliefs or, what's the word I'm looking for? Beliefs or, I want to say like procedures type education is, you know, and so we talk about like consent, you know, and we talk about the role of women within the tribe, or so we're able to try to, you know, incorporate that cultural competence into some of the education that we give. But there's you know, we're kind of split half and half. There's people who really appreciate that, and then there's another half that they don't really care. They're like, all right, just, you know, tell me what I need to know and give me my meds and I'll be on my way. So I guess, you know, the more we work with people, the more we're able to kind of gauge what they appreciate, you know, as far as like education-wise. We can't, you know, we don't use the word smudge, and not everybody likes that. And which, you know, I was like, well, you know, why not? So they got to talking about how, you know, there's a lot of like Catholic Christian people that don't believe in the traditional way. and vice versa. And so they didn't like that ritual of smudging every day. And so it was, you know, not only for us learning that, but I was like, our teachers go through so much in the schools to try to bring in that cultural, you know, there's a lot of people who want that cultural presence there, but there's a lot of people who are like, no, I don't want anything to do with it. So with this new curriculum, the health education teachers will be teaching it, and there's actually going to be the cultural aspect of it. There'll be like cultural mentors that can go in there and teach kind of like the Blackfeet part of it, the cultural significance of it. So, and the parents who don't want the kids involved in that can just sign a consent, like, you know, we're going over it this day, I don't want my kid part of it.
Okay.
So they're doing a lot to kind of bring that back in for like health literacy, and they go over anything from puberty to like hygiene, consent, healthy relationships. So it's a very detailed, and it's, you know, it's a really good curriculum. It's just kind of getting people on board with it. So
Okay. Right. Yeah.
and that'll be, I think they'll teach it 7th and 8th grade. And I think they're trying to get it into like even 9th grade health education. So,
Okay.
and that might be a little, you know, it's kind of one group. Could we go younger? We might need to, you know. Kids are going through the change a little bit earlier than what we used to see. But they felt, and with the state, they felt that that was a good age group, 7th and 8th graders. So that's a big cultural significance.
That sounds like a neat program.
Yeah,
It really does.
yeah, so it's been exciting.
Yeah.
Well, I think even though it was just the 4 of us
Yeah.
and we did it really fast, thank you so much. This was a really great start, and I think what I'm hoping to do is to meet with the different entities. My big dream was that everyone would show up here today. We could all talk just once. But I know that was a dream. You know, would you guys be open to maybe having more discussions or working together?
Yeah.
You could just say, hey, Erin, can you print this from CDC because, you know, we're trying to get word out, or, you know, I think approaching our social media a little more meaningful, like maybe on Wednesdays it's health information social media day, or, you know, so that we can put things out on a consistent basis. So yeah, I will definitely reach out, and then I'll also reach out on potential. I think that the community health fairs, you know, that might be maybe where I write grant resources for, but I think there's also other opportunities. And the great thing is, you know, the National Library of Medicine has programs that, you know, we can connect with and get some funding for. So.
Cool.
Yeah.
Well, yeah, let us know. I know you sent a lot of stuff to Barb, but we can be added too because she's so busy.
I know.
So she came in at 1:45. She was like, what time are you leaving? And I was like, 1:30. She's like, well, Erin has this. I said, well, we can go down there for a half hour. So,
I know. Thank you.
yeah, no problem. So just keep in touch with us, and if you need to, we can give you our emails or.
Okay. And
So.
And my email is LaFromboise, but if you don't want to worry about spelling LaFromboise, you could also do library@bfcc.edu, and that comes to me as well.
Okay.
And, you know, if you're looking up some of the, one of the great things that I think the network of National Libraries of Medicine, I almost got it. What they have is they have a lot of health information, like online sessions, and you know, that might actually be great for you guys to just see what's out there. And I've attended a couple of the webinars, and then I signed up for one class. I didn't participate very well in it, but but I think that's great for continuing education as well for information
Yeah,
professionals.
we definitely have some resources. And I'd also like to recommend, there's a website called Medline Plus. which has a lot of consumer level, patient level health information on it, and it's free.
So thanks for staying late.
Okay, thanks.
Nice to meet you.
Thank you very much. Really appreciate it.